or call in and order yours for pickup. 352-245-2419. La Famiglia Pizzeria.
Ocala's information station, 1370 WOCA.
Ocala.
All right, 7 minutes after 10 o'clock, got a short interview with a very important topic that we want to be sure to get you enough information so at least you can look up more information. The results of a new survey by the Leukemia and Lymphoma Society of Physicians and Patients is out, and we have on the phone to talk to us about it Dr. Jerald Radich. He's part of the Clinical Research Division and the director of the Molecular Oncology Lab at the Fred Hutchinson Cancer Research Center, as well as more credentials. I'll just leave it at that for now. And Gail Sperling is also on the phone, I believe. I think we have both of them. She's the Senior Information Specialist in the Information Resources Center at the Leukemia and Lymphoma Society. So good morning to both of you, Dr. Radich and Gail Sperling.
Morning.
Good morning.
Where are you calling from? Where are you both?
I'm in Seattle.
I'm in California.
Oh my gosh! Okay, so we got a big triangle crossing the country. Every time you hear cancer is a scary word, but when you hear about leukemia, it's like you can't even get your head around it because there's no tumor. Am I right? Or does leukemia have a tumor associated with it?
Well, it is a malignancy, it is a cancer, but it's of the white blood cells, and so it's just your hematopoietic system, the one that makes the red blood cells and white blood cells and platelets that are coursing through your vein. It's an organ system, and so just like breast and lung and the like, it too can develop cancers, and leukemia is a cancer of that system. And this disease we're talking about, chronic myeloid leukemia, is a particular type of leukemia. Before there was effective therapy, it would start slow, but in the end, most patients succumb to the disease in 6 to 7 years. Now with modern therapy, we've really made this into a chronic disease that's potentially curable in most patients.
So there's a word in my notes here that I need help with, polymerase?
Polymerase,
thank you.
Polymerase, chain reaction, right.
What is that?
So the really interesting thing about CML is that there's a specific mutation that occurs in virtually every CML case. And that mutation is the target of the therapy, but it's also a target for a diagnostic test, because these CML cells, as opposed to the normal white blood cells, have a unique genetic marker. And just like when you go on your crime shows, the NCIS shows and the like, and they're always looking for tissue or blood or something to identify the culprit, the PCR test is a way that you can really pick a needle out of a haystack and pick the CML cell out of a background of normal cells with the sensitivity of like up to one CML cell in a background of 1 million normal cells. So it's a way now that we can monitor patients with this disease like every 3 months. In the peripheral blood, we don't have to do repeat bone marrows anymore, which are obviously painful and invasive. And we can really see how patients are responding to therapy very accurately with just a simple blood test.
Does it help you figure out how to help the individual patient, or does the information, and specifically does the survey, give you information that is applicable to the population at large?
Well, the PCR test itself is been around now for a little while, and it really does give you specific information about how to treat the patient. The survey is more looking at how we're doing with this, both on how physicians are using the information and how physicians and patients are interacting. And I think the two most interesting points is that when you ask physicians, what's the value of this type of testing in CML management, virtually they all say that it's very important. But then when you ask them sort of how the rubber hits the road, only about a third of them actually test the patients at least every 6 months. And again, the recommendations are every 3 months. So there's a bit of a disconnect there. And the other disconnect is between what patients and physicians think they're saying and think they're hearing. So that about 70% of patients say they actually proactively talk to their doctor about PCR testing and their management. But when you flip that around, only about 20% of the physicians say the patients ask them about PCR testing. So obviously the focus of those two groups are
Okay.
a little bit different, and the communication there is a bit lacking.
And Gail, do you have a listing of all of the patients that are diagnosed with this so you can keep them abreast of all of the new surveys and that they should request this kind of test more often than their doctors suggest?
Well, as for a specific listing, not necessarily a specific listing of patients, that wouldn't be something we would have, but we do have some excellent education materials. We have teleconferences. So if somebody has identified themselves with our organization, the Leukemia and Lymphoma Society, they will receive, some information about an upcoming program, or that there's a new video on PCR on our website, and would encourage them to check that out. So there are a lot of efforts ongoing to make sure that patients and physicians and other healthcare providers stay well informed.
Does the patient feel something like a little ill, and does the test confirm that? Or I'm trying to figure out. Yeah.
Yeah. So most patients with CML actually are diagnosed under routine circumstances, like a health physical. And what you'll notice is that whereas your and mine white counts are normally between 5 and 10,000, theirs will be like 100,000 or so. So then at that point, when you think that CML might be going on, you can use this test to confirm the diagnosis. But what the survey is really talking about is once the person has the diagnosis and is getting tested, about a relatively non-invasive way to monitor how their disease is responding to therapy. And now it looks like some of these patients who get a superb response can actually be taken off therapy and won't relapse. They seem to be cured. And obviously, you would never know if you were one of those lucky few unless you did monitoring.
So okay, and so it helps confirm that they're doing better, even though maybe they say they feel better. But you need to know for
absolutely.
sure. Okay.
Absolutely. Yeah, because this is so much more sensitive than the old tests where you look in the bone marrow and look for leukemia cells. If there's less than 5% leukemia cells there in a background of the normal, you can't see them. Where this is really looking at 1 in a million, so you have exquisite sensitivity to detect the disease burden.
When we have a short interview like this, I feel like students cramming for a test, and so don't give us a test because I don't think I got it all yet. But I think I understand a lot in just like 7 minutes that we've been talking to you. However, I know.
Well,
Go ahead. We
have a phrase in medicine. See one, do one, teach one. So hear it one more time, and you're on doing them yourself.
Oh wow! I don't know about that.
Wow.
But you have a website. Doesn't the website help us out?
Yeah, the website will help.
And what is the?
That's it, really. There's always some more information out there, and we do have an excellent website. It's www.lls.org, and the Leukemia and Lymphoma Society also has an information resource center, and that number is 1-800-955-4572.
That's a good way to end it. Thank you both for being on, Gail Sperling and Dr. Jerald Radich. Thank you both for what you're doing and for getting up early out on the West Coast. Thank you.
Thanks very much for your interest.
All right, we'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Sunshine mixing with clouds today with a thunderstorm around this afternoon and early tonight. Today's high 88 to 92. Partly to